Hello and welcome to the 2024 ASCLD Train the Director webinar series in collaboration with the FTCOE. Today we will hear from Belinda Weimer, Research Public Health Analyst with RTI International, and Matt DeRose, Statistician at the Bureau of Justice Statistics, on a national snapshot of publicly funded crime laboratory operations. Without further delay, I will turn things over to our presenters.
I just want to thank everybody for joining us today. My name is Matt DeRose. I'm a statistician at the Bureau of Justice Statistics. BJS is the statistical branch of the U.S. Department of Justice. Also joined today by Belinda from RTI. We're going to talk a little bit about findings from the BJS Census of publicly funded forensic crime laboratories. So BJS is a statistical branch of the U.S. Department of Justice. It publishes dozens of reports each year on national statistics on the operations of criminal justice agencies at all levels of government. During the last few years, BJS has partnered with RTI to conduct the Census of Crime Labs, and we hope you find this information useful for your work. So we're going to have three primary learning objectives for the webinar today. First, attendees will hear about the main findings from BJS's Census of publicly funded crime laboratories, which has been conducted 5 times. First time was in 2002, again in 2005, 2009, 2014, and 2020. We'll also provide some information on where you can download the full reports with additional findings beyond those presented today. And in addition, we'll provide information on where you can download the data sets that were used to produce the reports. We'll also provide a brief update on the timeline and the plans for the 6th Census of Crime Lines that will be conducted next year. Next slide, please. So before discussing the findings from the Census of Crime Labs, we'd like to provide some information on where you can download the publications and data sets for those projects. We've got the BJS website where you can go there and type in Census of Crime Labs. That's one way to get to the reports. We've also provided a path in the chat here that you can use to download those reports. The data sets that are used to produce those reports are also available to anyone that'd be interested in doing their own analysis of the data or doing some things beyond what's in the final report. So that's at the National Archives of Criminal Justice Data, and that path is also provided. Next slide, please. Well, before we begin discussing the findings from the Census of Crime Labs, I'd first like to talk about the last data collection that was completed in 2022. In 2021, BJS and RTI sent a questionnaire to the 326 labs within the scope of the Census of Crime Labs. This included multi-lab systems along with those that were not part of a multi-lab system. An example of a multi-laboratory system is a state lab that has 4 regional labs. The Census of Crime Labs includes agencies that are solely funded by government and employed 1 or more full-time scientists with a minimum of a bachelor's degree in a natural science, criminalistics, forensic science, or a closely related field, and whose principal function was to examine evidence in criminal matters and provide reports on the results and court testimony as well. Next slide, please. So the last Census of Crime Labs that was conducted looked at the operations of crime labs in 2020. And overall, we had 90% of labs respond to the questionnaire. So what this is showing you is that the distribution of those 326 labs that were in the 2020 Census of Crime Labs by their jurisdiction and the number of employees in the crime lab. The lab type included categories such as federal, state, county, and municipal laboratory. Among those 326 labs or multi-lab systems, 13% were federal labs, and about 1 in 3 or 34% were state laboratories. The remaining labs were county and municipal. As for the size of the labs, 13% of the labs had 100 or more full-time equivalent employees, or FTEs. 14% had 50 to 99 FTEs, and nearly 75% had fewer than 50 FTEs. Next slide, please. So in 2020, an estimated 15,600 FTEs were working in the nation's publicly funded crime labs, compared to about 11,000 in 2002. The bars on the right in this graph show the breakdown of the FTEs by the approximately 2,700 in federal labs, 6,800 in state labs, and 3,000 in county, and about 3,200 in municipal laboratories. The graph also shows the distribution of the FTEs by lab type over time, which has been generally consistent between 2002 and 2020. As part of the report for the 2020 Census of Crime Lab, statistical significance tests were conducted on the comparisons made both at the 90% and 95% confidence intervals. If you'd like more information on the statistical significance test, you can find that in the methodology section of the latest Census of Crime Labs report. Next slide, please. So among the 15,600 crime lab employees in 2020, 62% were analysts. An additional 13% were managers, 7% were clerical, 6% were crime scene technicians, 8% were technical support, and 6% included other types of employees. This bar chart shows the distribution of the type of labs employed during 2020 is fairly consistent across federal, state, and local labs. Next slide, please. So overall, in 2020, crime labs hired about 1,200 employees, as shown in the blue bars here in this graph. But they also had about 1,120 employees who left the crime lab that year, and that's shown in the gray bars there. The graph shows these overall totals for federal, state, and local labs. On the right side, you can see that labs with 100 or more FTEs had the largest number of both totals in 2020. Next slide, please. So what we found in 2020 was that labs have reported about 1,500 vacancies in their staffs as of the end of the year. More than half of these vacancies, or 55%, were for analysts. Technical support staff made up the second largest number of vacancies. This graph shows that most vacancies within all types of crime laboratories, so federal, state, and local, were analysts in 2020. Next slide, please. So as we provide some more information here, between 2002 and 2020, the overall combined budget among the nation's publicly funded crime labs increased from an estimated $1.8 billion to an estimated $2 billion. State labs accounted for about half of the overall budget in 2020. Next slide, please. About 87% of crime laboratories had a laboratory information management system, also known as a LIMS, in 2020. This percentage increased across all types of labs between 2002 and 2020. Next slide, please. So as we get into some of the workload information from the Census of Crime Labs, found that labs received about 3.3 million requests for services during 2020. In addition, 3.2 million requests for service were completed that year. It should also be noted that in 2020, some labs suspended operations during COVID-19 pandemic, which may have accounted for the decrease in requests received and completed that year, compared to workload totals in previous years. Next slide, please. In 2020, state labs received the largest proportion of the 3.2 million requests at about 59%, followed by state labs at 20%, municipal labs at 14%, and federal labs made out of about 7% of the requests received for service. Next slide, please. Controlled substance analysis was the most common request for service completed by labs during 2020, while the least common request that year was for question documents. Next slide, please. So One of the other things that this study tried to look at was the idea of backlog request, and how this project defined that was that if it was a request that had not been examined and reported on to the submitting agency within 30 days. So at year-end 2020, Crime Labs reported a backlog of about 710,000 requests for service. The backlog in 2020 declined about 21% as compared to 2009, but we also saw an increase of 25% compared to the total in 2014. As noted previously, the need for labs to suspend operations in 2020 during the COVID-19 pandemic may have partially led to the increase in backlog requests in 2020 compared to previous years. As well as being the largest type of request completed in 2020, controlled substance analysis also made up the largest percentage of all backlog requests in 2020 at about 37%. Next slide, please. So to support their operations, we found that about half, or 47% of crime labs outsourced some requests to private labs or to other public labs in 2020. In comparison, 38% of crime labs outsourced work in 2014 and 28% outsourced work in 2009. About half of state, municipal, and county labs outsourced work in 2020, compared to about a third of federal labs. I'll now hand the presentation over to Belinda to talk about quality assurances in crime labs.
Yeah, hi everybody, good afternoon. So yes, I'm going to be presenting some findings from the census on quality assurance, and specifically, accreditation, proficiency testing, technical reviews, and certified staff. So first, here on this slide, you can see that in 2020, about a third, or 32% of labs indicated that a jurisdiction that they served required that they be accredited. Next slide, please. So accreditation has increased over time. In 2020, 90% of laboratories were accredited in at least one discipline, and that's a significant increase from the 88% of laboratories that were accredited in 2014. Next slide, please. So the most frequently reported accrediting bodies were the ANSI National Accreditation Board, or ANAB, at 81%, and the American Association of Laboratory Accreditation, or A2LA, at 7%. Others that were more frequently reported were the National Association of Medical Examiners, the American Board of Forensic Toxicology, and the College of American Pathologists. About 5% of labs picked the other category, and some of those that were written in there or included were the CALIA, or the Commission of Accreditation for Law Enforcement, and the FBI Quality Assurance Standards, as well as some state accrediting organizations such as the Texas Forensic Science Commission and the New York State Commission on Forensic Science. When you look at accreditation by lab type, a higher percentage of state labs reported being accredited by ANAB, and a higher percentage of federal labs reported being accredited by A2LA. County labs, they reported the highest percentage of being accredited by NAME, ABFT, and CAP, or CAP. And just wanted to point out that laboratories could report more than one accreditation. Next slide, please. In 2020, 98% of state labs had some form of accreditation, as did 94% of federal labs and 86% of county labs. There was a significant increase in the percentage of municipal laboratories that were accredited, which increased from 67% in 2014 to 82% in 2020. Next slide, please. And then when you look at accreditation by the size of the laboratory, most, if not all, crime labs with 10 or more FTE employees, so the four larger categories there, were accredited in 2020. Among the smallest crime labs, or those with 9 or fewer FTEs, 64% were accredited in at least one discipline, which was a decrease from the 70% that were accredited in 2014. In addition, the percentage of labs with 10 to 24 FTEs that were accredited increased from 2014 to 2020 from 90 to 95%, while the percentage of labs with 100 or more FTEs that were accredited actually decreased from 100%, so all labs in 2014 to 97% in 2020. Next slide, please. So the percentage of labs reporting some sort or any type of proficiency testing remained basically unchanged from 2009 through 2020, as you can see there in that first set of columns. So it ranged from 97 to 98%. In 2020, about 98% of crime labs conducted, proficiency testing, with 98% performing declared examinations, about a third doing random case reanalysis, and 11% doing blind testing. Though it's not shown here, the 2020 census found that a greater percentage of state labs than municipal or county labs conducted random case analysis, and that would have been 43% of state labs compared to 24% of municipal or county laboratories. So in 2020, about 99% of crime labs technically reviewed some or all of their casework, with 78% conducting technical reviews of all of their casework. 99.6% or 100% is shown here of crime labs had written standard operating procedures, and 98% had management system documents. And most again had performance verification checks, with 95% having some sort of structured training program. Next slide. So regardless of laboratory type, all or nearly all crime labs conducted technical reviews on all or some of their casework, and 87% of federal and state labs technically reviewed all casework, while a smaller percentage of county labs at 78% and a much smaller percentage of municipal labs at 59% did so. Next slide, please. So during 2020, 77% of laboratories had at least one or more externally certified analysts. And you can see that that has increased over time from 66% in 2009 to the 77% in 2020. And just to provide some additional information, you can see there on the side that the mean number of certified staff was 6.3, and the median, with the median number being 1.8. And I think these quality assurance slides definitely show that publicly funded forensic crime laboratories have a high adherence to and participation in quality assurance programs, and that has been maintained steadily over time. So there was a lot of findings presented here today, and what are the next steps? As Matt mentioned, we are working on the 2024 census of publicly funded forensic crime labs. The next census is planned for 2025 with a 2024 reference year, and the new instrument is currently being revised. We recently, in the middle of March, held an expert panel that brought together crime lab directors from across the country to talk about the 2020 instrument and topics to remove, and topics that were identified for consideration for adding, some formatting changes, with the aim to be making it less burdensome, but at the same time capturing the information that is most useful to the lab community. After the instrument is drafted up, we'll be conducting some cognitive testing to test the changes to make sure that the questions, are capturing what we want them to capture. And then we will be getting into the field in 2025. Next slide. And we just wanted to mention too, if you're not already, you can subscribe for notices when new publications come out. You can go to the BJS website at bjs.ojp.gov, and you can click on the subscribe button that's in the top right corner, and put your email in, and you can even identify some topics that you're most interested in, and you'll start receiving those notifications. Next slide. And that brings us to the end here for questions, I believe. And but you can see here that Matt and I can be reached at our email addresses if you have any questions about the census for publicly funded forensic crime labs or anything about this presentation.
Thank you, Belinda and Matt. I'm Erin Forey from RTI International, and I will be moderating this portion of our presentation today. One of the questions that we have in the chat is, how bad of a quality assurance issue is it when there is a software problem at the lab, which results in the same coding number listed on numerous GCMS chromatographs? I'm not sure if that's something that you could answer.
Not with the information we collect from the Census of Crime Laboratories. We don't get into that level of detail. I will say, however, though, that the National Institute of Justice, or NIJ, does look at these kinds of issues, and may have some research that's looked into these kinds of standards. So I would recommend maybe reaching out to NIJ to see if they might have some information on that.
Okay, thank you. The next question, in conducting hypergeometric statistical sampling plans for amounts of submitted samples, do you believe that the expected positive rate of 80% of the total samples with a 95% confidence rate is too low, as compared to 90% expected positivity rate with a 95% confidence level?
That specific kind of information be another thing that we don't capture in the questionnaire, and I did speak a little bit about statistical significance testing at the 90 and 95% confidence intervals, but that was more for the adjustments that we do with the data, because of when we don't get responses for all the questions, we have to do some statistical adjustments and create confidence intervals for the comparisons.
One other question we have, if you could comment on any of the main changes for questions due to new technology.
Belinda, do you want to talk a little bit about that? I know that's something we certainly want to look into a little bit with the new questionnaire, and trying to delve into new technology. So we're working on some questions there, and definitely we know that's something going to be important. But Belinda, I don't know if you have anything to add as well.
No, we're still coming through, we're still working through all the changes from the expert panel, and the lab directors on the expert panel provided such great feedback. And that's one of those sections where we'll continue to go to them and make sure that we've captured what needs to be changed there. So other than that, though, just as Matt said, that's an important part of this, and we'll certainly be looking at that.
And if I'm not mistaken, you have a fireside chat as well at the upcoming symposium for ASCLD about the census. Would that be an opportunity for people to provide feedback as well as what might be helpful in the future census?
Yes, I think, yeah.
Yeah, looking forward to that, to be down there. We'll have about a half hour or so. I think it's Wednesday morning at the ASCLD Symposium, to talk a little bit about emerging issues and topics that will be important for the next data collection.
Thank you. Another question, how is this data being used to help ensure that laboratories are adequately funded for optimal operations?
Well, that's certainly something, we've tried to identify potential, areas such as accreditation, other kinds of quality assurances where certain labs could use some additional funding. We've provide information on vacancies and trying to get a sense of staff that have left. Now, a lot of these studies that we do are national level statistics, but we do hope that does help to shed some light on where some additional resources are needed. I know there was also a needs assessment that was done several years ago to try to dive into this a little bit more. Census of Crime Labs was one data source for that needs assessment, as well as some other data sources out there. So this is a data collection that hopefully will provide some information, but it's also primary purpose is to kind of look at things at the national level and hopefully give laboratories the ability to compare things going on in their jurisdiction to the nation.
Mhm. The next question, 1.8 billion to 2 billion budget over 18 years. Is there info tracked on how much budget is requested in contrast?
No, we don't pick that up. It's one of those things where we do ask them what their operating budget was for that year. But things like expenditures, we've collected a little bit of information on that in previous Census of Crime Labs, but we don't have that level of detail in terms of budgets that are actually being requested versus what it's allocated.
While not in the majority, there are a few forensic labs housed in public health laboratories. Do you plan to include them in future work, or perhaps they already are?
So we have, we kind of have a definition that does somewhat limit its scope in terms of what we collect. We know there's a lot more forensic analysis that's going on in police departments. One thing I will mention is that BGS also conducts a census of medical examiner corner offices. And so that does help us get at a little bit more work in terms of what's going on with forensic work at the public level. There's primarily we're looking at police departments and crime laboratories they're operated through police departments, but there are some other types of agencies that operate crime labs that are within the scope.
Now, you may have seen a pop-up poll question that just popped up on my screen. I don't know if you want to explain that to our audience or not.
Sure. Yeah, there's kind of 3 or 4 main sections to the kinds of information we collect, and it's always helpful for us to see what information is most useful that folks are using. We know that this does require a good amount of time for laboratory directors and their staff to provide responses to. So we also want to make sure that when we're asking them to respond to questions, that we're collecting information that's going to be useful for them, and it's always interesting to see how they use that information for their work as we develop the next one.
So if our audience folks wouldn't mind answering these poll questions, that would be very helpful to Matt and Belinda. Another question we have, do you track projected retirement, expected loss of staff beyond open vacant positions?
That's not something we've collected in the past. As Belinda mentioned, one of the things we do when we try to add new questions is that we make sure we can get information that's going to be consistent across all laboratories in the country. And so I know that could be something that could be a little bit difficult to get a consistent measure for, but we've heard this before, that this is something important, be some important information to know about in terms of how that contributes to vacancies. So we'll definitely continue to look at that and see if that's something that we can collect some information on.
Do you know what percentage of the laboratories are non-law enforcement run or funded? And if so, are there differences with funding and staffing?
That's something we wouldn't have. I don't know exactly what those breakdowns would be, and in terms of non-law enforcement versus law enforcement, but just in terms of getting at that level of information, that's not something we'd be able to provide.
Are you tracking personnel by tenure?
That's something we haven't asked before as well. We do ask for staffing totals by different positions, and we've asked some information about vacancies and things of that sort, but we haven't gotten into asking kind of what the average tenure would be or how long staff are in place, but it's very interesting to know that could be something important to know about and how that can impact workload. So we'll definitely try to see what we can do to get some information on that topic and see if it's something that, again, you know, we've got 300 to 400 respondents, and we need to make sure that they're all going to be able to hopefully provide that type of information, and it won't be too burdensome, and it'll be consistent responses.
In the census, does it give you an idea of the average number of analysts that might be in a unit like latent prints or seized drugs?
We currently only collect by the type of position. We don't get into kind of how it breaks out by discipline or different sections of the laboratory. You know, very good information, I think would be to have that. It does, like I said, though, it does get a little tricky to try to go out to all the labs and get too granular with some of this information. We know it's very important, though, so we try to do that when we can, but we also know that some laboratories aren't going to be able to provide all of that information. So we have to kind of balance that a little bit. But again, this is great information to hear that this is something of value to the community, and we'll look into seeing if we can provide some of that type of information.
Thank you. Next question. Do you track amount or level of federal grant funding by lab type?
That is something we have looked at before. I mean, right now, I think we're asking if they do receive grant funding. I think in the past, we have gotten into amount of grant funding that's been received. I think some laboratories had a little bit of a problem in terms of being able to provide those totals, but that's definitely something it's important to know. It's something we can definitely look at and try to include in some cognitive testing to see if we're able to get at that information and then be able to provide some averages by laboratory type.
This next question is a follow-up to some of the earlier questions about sampling. Why don't state labs conduct quantitative analyses to determine purity and potency of controlled substances? And a comment, all of my federal cases have the DEA do quantitative analysis as well as qualitative.
That's not something I would have any information on through this particular data collection. But I would maybe recommend our sister agency NIJ to see if they have any types of quantitative or qualitative information on that topic.
The average pay per analyst per state would be interesting and helpful for showing at the State House when asking for more funding.
Right. Yeah, that's salaries is definitely something we've collected in the past. Again, we have to kind of balance trying not to throw too many things into a questionnaire and a survey that will take take the laboratories a long time to respond to. So some of these things we collect not every time, but periodically, and we do have some previous information on salaries, but we can definitely look into that and kind of consider if that's something we could collect with all the additional other topics that will be included.
I think a lot of the professional organizations, ASCLD being one of them, create salary surveys and have some studies available as well. So that might also be a source if somebody's already gathering that data for you to help work towards the census. That's all we have for questions right now. I'll give everyone a moment to see if they have any others. Yeah, Robert Thompson just commented, the CAC sends out a salary survey that is extensive. Thank you, Robert.
Thank you.
I'm not seeing any further questions right now. So with that, I will thank both Belinda and Matt for being here with us today to share this information about the census. We're looking forward to seeing what the new path forward for the next census will be as well. And we'll have to have you back then to share what the outcome is. So on behalf of ASCLD, Train the Director Series, and RTI and FTCOE, thank you both for being here. And thank you all to our attendees for taking the time to be with us today.
As you depart, we kindly ask that you take a minute or two to complete our post-event questionnaire. The link will be pasted in the chat and also appear as you exit the Zoom room. Your feedback helps us improve our outreach efforts and continue to provide the best experience possible. Thank you again for attending, and we hope everyone has a great day.